Every day, hospitals and health systems see patients who are victims of human trafficking. To call it an invisible problem doesn't quite capture the reality. There are signs that a person has been a victim of this despicable practice, but you have to make a point of looking for them. And that's where New Jersey based Atlantic Health System has been a model of success. The organization's human trafficking response, recognized throughout the state, is a testament to leadership buy in that starts at the top. Today, we'll learn how Atlantic Health System transformed recognition and response processes to human trafficking to make their communities safer. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter with AHA. AHA's Hospitals Against Violence, or HAV initiative, provides tools and resources to hospitals and health systems that are working to prevent community violence and violence in the workplace. And a new offshoot of that initiative, HAV's Combating Human Trafficking, focuses on providing tools to healthcare professionals to improve their responses to victims of trafficking. Sharing stories that inspire is part of this important work. Today, we're pleased to welcome two experts, equipped with great stories, to discuss the importance of C-suite leadership in supporting efforts to raise awareness of human trafficking in the communities their hospitals serve. Ingrid Johnson, RN, is Patient Access Manager at Atlantic Health System's Overlook Medical Center, and Brian Gragnolati is President and CEO of Atlantic Health System and was the 2019 Chair of the American Hospital Association's Board of Trustees. Ingrid and Brian, thank you both so much for joining me on this Advancing Health podcast today.
Thank you for having us.
I'll start with you, Ingrid, if we could first. Can you talk briefly about how you became so passionate about efforts to address and combat human trafficking?
Sure. Thank you for having me today. In 2005, my daughter, she's one of the oldest of three children, she went missing for 11 months. She was a typical teenager, honor roll student in a private middle school in New Jersey. She went out trying to make friends and do as teenagers do. And so all of a sudden, I did not know where she was. I went to local law enforcement. I called community partners in my community, and no one had seen or heard of my daughter. I couldn't figure out why she was missing. And I can just say that when I finally recovered her, I realized how beneficial it was that I was a nurse, and that I had insurance and some means to help her to get back to our reality at home. Clinically, I have a diverse background with homeless health care, mental health, emergency nursing, and critical care. It's also important to mention my role in the coordination of care for programs like Ryan White, those living with HIV. And so I hadn't met anyone else in the community that had my background or understanding from the lens of a healthcare provider. And so therefore, I realized that there was a need for a mom who had rescued her kid to help rescue others.
And how do you take a story that is so powerful and personal like that and translate it into beginning to formally build programs within the hospital to raise the issue of human trafficking among your colleagues and your staff?
In 2012, I began speaking with our leadership here directly at Overlook Medical Center and began to represent our system in some community grassroots initiatives. Out of that birthed one of our community partners, the New Jersey Coalition Against Human Trafficking. Today, they are now a 501c3 organization with completely volunteer staff and members representing over 70 organizations throughout New Jersey. My chief nursing officer had told one of our leaders about my story and my past involvement in the city of Newark and what was then the Newark Coalition Against Human Trafficking. I then met with a few others, and the rest is really history. I became a member of the coalition, followed by becoming a co-chair of the healthcare committee, and I now serve on the board of trustees. Prior to this, I've served on other boards and had various roles in New Jersey and nationally in my effort to inspire others to join in the fight against human trafficking. I believe in inspiring hope in survivors and their families. So you can check out my website to learn more about my story at ingrid-inspires.com. But it's important to mention that Atlantic Health plays a significant role in my journey. I've been employed here for about 20 years. My family has been extremely supportive of my efforts to speak for the voiceless. So Brian, as my senior leader, our president, and my corporate finance directors and leaders and all here at Overlook have embraced me and my family as we work to save lives in the fight against human trafficking. Brian leads the way as he has opened the door that allows our organization to expand its reach.
Brian, at what point did you become aware of Ingrid's work and what she was doing on human trafficking and decide to get behind and help?
Well, Ingrid's work was well underway by the time I arrived at Atlantic in 2015. And one of the things that I did as part of my way to stay connected in the organization is have these food for thought sessions. I think I've done since 2015 almost 100 of them. And one of the first sessions I did, I met Ingrid. And these are sessions where you bring together, 15 or 20 team members from throughout our large organization. We have over 18,000 team members at Atlantic. And it gives you an opportunity for an hour just to get to know people and engage in a dialogue. So we always start with a roundtable. Tell us something about yourself that we might not know. And it was there that I learned about her story and her experience. And that really is what generated, I think, has been a multi-year relationship that I have with Ingrid. As a matter of fact, we were opening a vaccine center for the state a few days ago, and my day lit up when I saw Ingrid there working and helping us do that. In early 2019, I learned from my leadership team that Ingrid had been nominated for the Jefferson Award, which is a pretty big deal, and that there'd be a ceremony in Washington, D.C. So I traveled down to the ceremony, unbeknownst to Ingrid, and the organizers actually hid me during the reception so that I could just kind of pop down, sit at her table, and surprise her. Had an opportunity to meet her daughter, who was actually the person who had nominated her mom for the award. And it was just wonderful to be there with Ingrid's family. And when she was called the winner of the Martin Luther King Jr. Champion for Justice Award and the Jacqueline Kennedy Onassis Award for Outstanding Public Service benefiting local communities, I just couldn't be more proud of Ingrid and the work she's doing. So, this has become really embedded in our organization, and Ingrid really is the driving force behind that. And when I say driving force, Ingrid is a force beyond nature. And when she gets behind something, it happens.
That is a wonderful story. The surprise visit is just great. But to follow up on that, you say it's embedded in the culture. Does that translate to specific policies and procedures that Atlantic's health system has put in place to inculcate human trafficking awareness in the culture of the organization?
It really has to. But what starts a lot of initiatives is somebody's passion and their ability to make an impact. Because, there are so many important issues that we deal with in healthcare organizations, and there's so many tragic stories that we hear. And but the real question is, how do you parse this out and really emphasize and get the organization to retain focus on it? And that really takes an individual with the passion and the fire and the ability to not take no as an answer. So we have really made some important steps in embedding this in our organization. And Ingrid has almost unilaterally been the resource for us. I know in our corporate cafeteria, there's a big poster that talks about this with Ingrid's picture on it, and I see that every day. And that visibility is an important aspect of this. We've established a human trafficking committee, which Ingrid co-chairs, and hopefully she'll discuss a little bit of that. We also worked with the American Hospital Association on its Hospitals Against Violence initiative. But we also put steps in, such as mandatory training for all of our team members, so that our caregivers, no matter where they are in our network, whether it's the emergency departments, our clinics, or in our practices, recognize the sign of trafficking. And then it gives them the tools to help step in and make a difference.
What advice would you have? This is a question for both of you. What advice would you have for someone who sees an opportunity for their hospital to do more in recognizing and caring for victims of human trafficking? How do you suggest they ensure the kind of buy-in from the top down that we've seen in Atlantic Health System?
Well, I'm a dreamer, and when you're up against odds, which has been the story of my life, you own your dreams. I've never been one that takes no for an answer, and I've also never been one that allows others to determine solely my destiny. And so I say to those who see anything around their organization or the communities that they serve to be vocal, learn how to gain your voice appropriately so and professionally. And also open yourself up to networking within your organization. You know, I wasn't afraid to speak up when I met Brian. I was timid, but I wasn't afraid. And he also Brian made me feel comfortable to have a voice within the organization. And I believe he came providing a process and a platform for all employees, not just Ingrid. So don't be afraid to think out the box and avail yourself outside of your job title, your duties, and your responsibilities. You know, people say, "Hey, Ingrid, you're not a nurse here. You're the manager of patient access." And I tell them, I am a nurse, and I was a nurse who was asked to come to become the manager of patient access. And no one asked me to stop being a nurse when I took on that responsibility. So I embrace my role in healthcare. No matter where I go, Nurse Ingrid comes with me. I utilize my experiences to help mentor my team and other people who don't report directly to me. Nurses are leaders. We no longer need to mark our success based on ordinary life experiences. Successful organizations like Atlantic Health are looking for people like me who professionally speak up and speak out. And so we make the difference in our organizations and in the lives of the people that we serve. I'll turn it over to Brian.
You know, we all wonder in life if we can ultimately make a difference. And I think Ingrid is living proof that we can. You know, if you're passionate, if you're committed, you can change the world around you. And in choosing to share her story and her expertise as a nurse, she has changed our organization for the better and is inspiring all of us to make a difference. And I know that the American Hospital Association, when we talked about Ingrid, really latched on to the story and what she's been able to achieve. Because, you know, violence is a critical thing in healthcare. It impacts so many people in so many ways. And people don't really think about trafficking in the way that I've learned through Ingrid to think about it. So it's a place to start this conversation, places like this where we're having conversations broadly. It's just so important to have passion and to not give up. And Ingrid, you're a model of that. And thank you for everything that you do for all of us.
Absolutely. Ingrid, I was just thinking that anybody listening to this podcast probably wondering, how is your daughter doing now?
My daughter is now 30 years old and embarking on her own success. When I recovered my daughter, she came back home in February of that year to the eighth grade. The private middle school would not accept her back. Quite frankly, they didn't want to deal with the issue. She tested in a gifted and talented program for our local public middle school. And that same year, the June, she graduated from the eighth grade after having been missing for 11 months. She then went on to a magnet high school in Newark, New Jersey, and went on to college in Jersey City and finished college in 4 years. So she now is honing in her own successes. She's a mother of a beautiful granddaughter that I have, and she really is doing what I coached her to do, which is, as women, I felt strongly that we allow negative situations to make us hide, which makes us more vulnerable. And I took the lead and said, I refuse to live a life where I raise a daughter to hide behind life's issues, that I felt that her health would be at stake and that she would be healthier if we told the truth, at least to ourselves. And then if we also shared the story to help someone in safe spaces. And so that is the nurse in me, that we need to be truthful. Our patients are looking for the ability to trust us in healthcare. Atlantic Health lives on the fact of being a trusted network of caring. And so I believe that as a nurse, I believe that's what I signed up for, and that is how I raise my family.
So glad that story has a great ending. Thank you so much. Thank you both, Brian and Ingrid, for being on this podcast today. And congratulations on Atlantic Health's outstanding work and the example it sets for others. We're releasing this podcast to coincide with January's Being Human Trafficking Prevention Awareness Month, so that we may continue to raise awareness and fight human trafficking together. For more resources and tools on violence prevention, please visit www.aha.org/hospitals against violence. And thank you for listening.